This is Outcomes, a show about uncovering the hundreds of micro-innovations that help make Australia's healthcare system one of the best in the world. On the show, you'll meet the doers, the Australian clinicians, care workers and healthcare professionals driving the micro-changes we seek to showcase. Theirs are the stories we're here to tell. I'm your host, Will Egan, and I'm the CEO of AusMed Education. I'm really passionate about improving the health and prosperity of the people in my community. I believe Australia does have a great health system, and every conversation we have on this show highlights why. Today, I'm joined by Stefan Gruenert. Stefan is the CEO of Odyssey House Victoria. Odyssey House is a drug and alcohol treatment service that sees problematic drug and alcohol use as a symptom of other underlying issues. They approach client engagement by offering peer support from others in recovery alongside the traditional medical and psychological expertise needed to treat addiction. In this show, we're covering the importance of finding the right balance of these factors. That's peer support and clinical care. Why emotional regulation is vital in addiction treatment, and the impact that becoming Rainbow Tick certified had on their organisation. It's going to be a great show. Let's jump in. So today we're joined by Dr. Stefan Gruenert. Stefan is a registered psychologist with more than 20 years of experience in the drug and alcohol sector as a clinician, researcher and manager. He's currently the CEO of Odyssey House Victoria, a board director of the Victorian Council of Social Services, and the immediate past president of the Victorian Alcohol and Other Drugs Association. Stefan has worked as a senior counsellor in a range of settings and has conducted research on alcohol use, treatment effectiveness, intimacy, family work and fathers. Stefan has contributed to several resources for workers around parenting and family violence, and he regularly provides advice to government and delivers presentation at national and international conferences. In 2008, Stefan was invited to a meeting on global drug policy held at the United Nations Office on Drugs and Crime in Vienna, and he received a Harvard Fellowship to attend Harvard Business School in 2014. Thanks for being on the show, Stefan. It's great to have you here.
Thanks, Will. Great to be here.
So Odyssey House is a really significant and substantial organisation here in Victoria. Could you tell us a little bit about what the work is that you do?
So Odyssey House in Victoria has been around for about 45 years. And we actually originated from a model that came from New York in the United States. And at that time, most drug or alcohol treatment was being conducted in hospitals, and there was returned soldiers and people with lots of trauma. And I think the medical establishment felt that it had the tools to sprinkle some magic dust on the patients there and hope they'd get better. And it wasn't working particularly well. And a psychiatrist felt that the people themselves had some of the solutions or the answers to their problems. So she thought, let's get them out of the hospital setting. Let's make them a partner in their own recovery. And we'll just bring the best of sort of Western medicine and psychological interventions to that way of working. And she established a therapeutic community. And from that blossomed all sorts of programs. And that's sort of been the foundation of the way we've worked at Odyssey here. But we've developed a range of different residential programs, but a whole lot of community programs, counselling, programs in schools, programs in people's homes, day programs as well. So we now operate out of 20 or 30 different sites across Victoria, and we work with more than 15,000 people every year.
Wow, yes, that's a very substantial footprint. Would this be one of the larger drug and alcohol services in Victoria?
Yeah, it is absolutely one of the larger ones. And we work across youth and adult and do a lot of work with families. So that gives us a pretty big footprint.
And what would be the typical workforce makeup? So is it typically social workers, or are there a lot of clinicians, psychologists, nurses?
The social workers are probably the largest part of our workforce. We have in our residential programs about 50% of our staff have their own lived experience of addiction and recovery. And that really is part of our success, I think. It gives our residents the hope that change is possible. And combined again with social workers, we have some nurses, some psychologists, some GPs and consultant psychiatrists. And sometimes just people who come from a range of different areas that might have been tradespeople or worked in recreation, someone who was a tattooist who decides to change career and does some study in our area, and they bring their own authentic self and energy to the mix. And I think all of that makes it, one, a great place to work, but also it caters for the diverse needs of the people who come and seek our help.
Obviously, for any service to have the type of impact that Odyssey House has, there's a lot of innovation that happens both at a whole of organisation level and at a micro level, maybe one or two people in one of those residential services making a small change that makes a big difference. I always think of them as small trees that fall in the forest that no one hears except for one or two consumers or the direct beneficiaries. Today, we're here to explore a couple of initiatives along that line that Odyssey House has implemented over the journey that have led to some of that change. So I'd love to jump into that conversation, starting with the first one, which is the concept around emotional regulation. So tell us the story behind that.
Some years ago, when we're trying to understand what is it that makes a difference, when you're working in drug and alcohol, there's so many things going on for people they're often struggling with housing. They've got lots of relationship problems, financial issues. They often experience a lot of trauma in their past. And it's like, where do we focus when people come to us? Got legal issues. Where do we start? What's most important? And we did a lot of looking around the world at the research. And what kept coming up is if you help people to establish really positive, pro-social, healthy relationships, then a lot of the other things falls into place. And when we looked at the outcome research, we found that one thing kept rising to the top in predicting that, or as a foundational skill in relationships, and that was the ability to manage or regulate your emotions. So it's really difficult to maintain a relationship if every time things get stressful, you lose your cool and your emotional state sort of takes over. It can do a lot of damage. So we started thinking, well, how do we incorporate this into our work? One of the great things about working at Odyssey, because the foundational part of our model and our therapeutic community is that people in the program, our residents and our clients in our community services are partners in that journey. So we have a lot of conversations with them, and we really explored this idea, and we got some consultant psychologists to help us understand what's the best practice around emotional regulation.
And is this for the clinicians, the carers, or is this for the clients as well?
It's funny, the program we've ended up putting into place, all the clinicians go, this is fantastic. This has been so helpful for me personally and in my life that, I've got as much out of it as when we're sort of working with our clients to help them to best understand that. So, the concept's quite simple in terms of your emotions sort of come and go. And when you're in an emotional state, be really mindful of that, and instead of thinking you have to react or respond or fix things, to just sort of let that wave pass. And there's a bunch of strategies and things to put in place to do that. And of course we do it in more depth and get people to practice and think about what are the things that trigger them and what are some strategies that work for them to really help them just observe, be aware of those emotions and let them pass.
And is that the fundamentals of the program?
That's exactly it. And we do it in a group setting, so people get to not only share their own experiences of that, but they get to hear from others. And sometimes they're like, oh, yeah, that happens for me too. And one of the other innovations that we did around this is not only do people participate in the residential programs as a participant in the class with a couple of people going through the program and facilitating that learning for them, but then at the end of that, each participant becomes a co-facilitator to teach the next group of people. So they get it as a participant and also as sort of a teacher, which both reinforces the message, but it also keeps the program really grounded and has credibility for our clients, because at least one of the facilitators is a resident still in treatment who's sharing from their own experience the parts of it that have been really powerful.
So you're saying there that it's a learning program that involves both the clients and the clinicians at the same time, learning together?
Not so much. The clinicians or the staff members would have done a training, and some of that training is experiential. So you do learn about and reflect on yourself when you're doing the training. But when you're delivering the program, it's very much focused on the residents or the clients in treatment. However, we do include a past participant from the program who is still a client in treatment, who co-facilitates the delivery of the program with the next group of clients. So in a sense, they're both delivering it, but they're also not that far away from when they were doing the program themselves, and they can reflect on what was powerful about it for them.
That sounds very powerful. And I think them championing it, they would still be seen as a peer, maybe further down along in their journey than some of the other people involved in the program. So is the purpose that to give people hope and reinforce that it is possible to overcome addiction?
Absolutely. But we also find that our outcomes and the experience and how the program runs works so much better when the peers are sort of front and centre at each step of program and service delivery, including the proportional lived experience we have on our staff. If we get that balance wrong, if there's too many sort of clinical and social work and other staff that don't have a lived experience, then our program becomes a bit more clinical and it loses its, ability to really tap into and relate to the things that are going on for people. Plus, their radars for all underground behaviours and denial and all sorts of things are never as good as our staff with a lived experience. And vice versa, if you've got too many peers or people with lived experience, then you lack some of the rigour that you can bring from science and from all the other learnings that we have around the evidence. The magic happens in that balance. So each part of our program, people go through phases, and they're generally supported by people who are just one step ahead of where they are. And so absolutely that gives them a hope that, hey, I can see how they're behaving at the moment, and they're looking proud, they're looking well. And yes, they might have spent some jail time or done it tough on the streets or whatever, but they're managing themselves really well. I want to be like that. And that really helps motivate people because the journey can be pretty tough and the work is pretty hard.
That's fantastic. So the balance needs to be right, but there's a good engagement from former clients or people who have successfully gone through recovery are involved in the program. The program's more authentic, more engaging for people at the start of their journey or the next step in their journey.
And it's a kind of a co-production or co-design process. I know that word's used a lot now, and that's kind of been fundamental for the 45 years we've been working, that not only do you utilise current clients or consumers to ask and inquire about what their needs are or their gaps or their experience, but also people on staff who've been through that journey, who are perhaps former clients. They're really involved in the design, but then it's a kind of continual learning process. So it gets adjusted and tweaked in response to feedback as you go. And then also really important in the evaluation, their feedback to see whether this is working and we're getting the kinds of outcomes. So that's been fundamental. The danger or the challenge for us in that whole process is we often get surrounded by people who our program has worked well for, and the people who it doesn't work for, who might have left, we don't have that ongoing contact with. And so that's the challenge for us, to always try and find who hasn't it worked for and what was their feedback.
Well, that's a good segue. I think that's the risk there of potentially the echo chamber, which would definitely be the case in all organisations. But that's a good segue into our next example, which is the journey that your organisation has gone on around Rainbow Tick accreditation, which sounds like it was something that was catalysed as a result of some of that type of feedback you were just alluding to. Can you tell us a little bit about that?
Look, we had some feedback from some members who, identify as being part of the LGBTQI community, who'd accessed or tried to access our services, and it may have just been the way they were, initially welcomed or greeted by one particular staff member, but they didn't feel particularly included. And although we thought we were fairly progressive as an organisation, I think we soon realised that there was really pockets where that was probably the case, and it certainly wasn't consistent across all of our services or our frontline staff. And when we looked at, okay, how do we improve this? Do we just go out and do a whole lot of training for staff, or do we bite the bullet and spend a bit of money and really invest in going through another accreditation process, which it's quite an investment from staff at all levels to do. And so we decided to do Rainbow Tick. We weren't certainly an early adopter of that. We saw that a few others had been through it, and we saw that it was becoming something that was more common. And so we started that journey, and I think everyone was pretty surprised by just how many things we possibly weren't doing as well as we could. So we did get almost all of our 250 plus staff to undergo some significant training. We made lots of policy changes, but I think the real impact happened in local conversations within our residential programs. We've always had a bit of a principle or a rule about trying to avoid people getting into exclusive relationships.
What's an exclusive relationship?
So anytime two individuals would go off and start chatting or spending more time together rather than participating in the whole program, there's a whole lot of flags that go up. One around sexual safety, because we had a lot of slightly older men and younger women suddenly form a relationship and then leave the program. And then sometimes one would come back and say, I sort of felt coerced into a relationship, and it felt like everything was great and that relationship was going to solve all my problems, only to realise that it wasn't a really healthy thing to be a part of. But it also means that they're not as available to their other peers in the program, and sometimes they can be discussing things that come out of groups in inappropriate ways, or breaking confidentiality, or holding secrets of behaviour and things in the program. So the way that had sort of played out, because most of our clients appeared to be heterosexual, and that's everyone's thinking, it became, well, a man and a woman or two residents, male and female, can't be alone together in the program unless they're out in public area or public space. And then we realised, well, that doesn't kind of work if there's gay or lesbian couples or bisexual people, and why is it just male and female? We were very heterosexual in our thinking there. So things like that, things how we did our urine analysis and the choices we were giving people in terms of what part of the accommodation they felt most comfortable sleeping in, all of these were questioned by going through this process. And when we came out the end, not only did we do really well on the accreditation, and particularly for our first audit, we started seeing a huge influx of the number of people accessing our services. And we had, all the flags and symbols, and people were introducing themselves using their pronouns. And all of a sudden, in our Resi services, we had 20-25% of people identifying as part of the LGBTQI community. People said, we did Resi rehab once before, but we didn't come out as gay, or that we wanted to transition. And so there was always a part of us that we were sort of hiding from the process, and we weren't feeling authentic. And this time it feels completely different. We had some people, a gay couple, go right the way through the program recently. We had someone announce they wanted to transition, and the whole community sort of cheered and celebrated that, and they were really supported on that journey. And just, they're bringing their whole self to that treatment experience and all the vulnerability. And so the validity of the changes that they make is so profound for them, and the support they were feeling, that was such an incredible part of their journey. So the outcomes have been quite profound in that sense.
It's obviously such an essential thing in a service like yours, that somebody's able to bring their whole self to your team. They're obviously dealing with very challenging things in their lives, and to not feel that they can divulge everything about them, everything that's actually factoring into maybe some of their behaviour, some of their addiction, the drivers behind that, must have been quite prohibitive or restrictive for them. Could you talk a little bit about that? And have you seen obviously an increase in people who are identifying part of that community, but has it led to a change in their success going through the program?
I think we don't know the answer to that in terms of outcomes yet. It's a fairly recent initiative for us, and we haven't done the sort of longer term follow-up to really look at that. But I think anecdotally, you're absolutely right. The ability to be authentic in your relationships is a critical foundational block to that thing about having healthy and positive relationships. And so many traumas for people, particularly members of the LGBTQI community, arise from, being bullied or feeling different or being ostracised or not feeling like they fit in or belong. And so the capacity to share that as part of your treatment in a group of your peers and examine how that's impacted your addiction or the emotions that you experience and how you mask them or use drugs to sort of handle that is absolutely right. So I think it fits beautifully into what we think will make a difference to outcomes. The early indicators, both in terms of the numbers of people coming through and seeing their retention in the program, and the feedback that we're getting in our client experience surveys where people are saying, yes, they're feeling more welcome, more respected, or that aspect of their treatment has been sort of supported, are all positive indicators. I guess the next step is then seeing whether we're getting really good outcomes for those members in the community and if they're on par or better than other people accessing our treatment.
And tell us a little bit about the conflict and how you overcame that, because these can be politicised issues amongst the workforce.
Yeah, it's interesting. We experience very little challenge or conflict or resistance from our clients who come from such a diverse range of backgrounds, and some are very traditional masculinities and some don't, and some come from very sort of poor intergenerational patterns of poor relationships and conflicts. And we were kind of surprised that amongst our clients are really embracing a more inclusive way of working. And, they keep coming to us saying, we're all of the sort of forgotten or the left out people, and the more people you can help, the more who feel safe and welcome here, the better. I think it was more some of our partners or our staff that I guess would highlight at times the tensions between different specialist populations. So why are we focusing on this group when there's Aboriginal Torres Strait Islander people we need to focus on, or people with disabilities, or people from cold communities? And how do we balance where we put our energy and investment? And some members of different faith communities, we've got some programs targeting people from the Islamic community or Muslim faith who would often not seek help from any services and just end up in prison because of their drug use, because there's so much shame and stigma in their community around alcohol or drug use. And that's hard enough to deal with, let alone thinking through issues of sexuality and gender identity and how that intersects with faith. So I think the challenge was more we needed to invest in it significantly over a period of a couple of years to really do the training and embed it down. And then we clearly want to maintain that. But how do we make sure that everyone feels welcome and included, and it's not just members of that community? Because there's so many different groups who face barriers to accessing treatment. And we're trying, to look at each one of those and continually think who's got the greatest barriers. And sometimes we need to do things quite differently to that group to even get them on an equal footing from other people who perhaps come from more privileged parts of our community. So it can look like we're doing very different things, and that can be challenging, but we feel we need to do it just to get some equality.
I think I might jump to the smaller micro innovations that your organisation's able to activate as well through the form of your innovations grant scheme. I think this is a fantastic idea, and I'd love to kind of hear a little bit more about that as well, because it sounds like something that has a big impact for a relatively small cost. Tell us a little bit about what the innovations grant scheme is that you run at Odyssey House.
So a few years ago, we were thinking, how do we make sure that people on the front line who are closest to our clients or service users are able to come up with sort of ideas that are really grounded in what they're seeing, the gaps they're noticing, the little changes that they think could make a difference? How do we support them, encourage them to share their ideas, and then support us as an organisation to implement that? So we came up with this idea of having an annual innovation grant that we announce to staff, we give them a bit of time to think about, and then we ask them to share their ideas. And it's just one pager. What's your idea? What might it cost to implement? And what are the sort of benefits or expected outcomes that it might deliver? And, each year we might receive 10 to 20 of those. And then the executive team will sort of sit down and look at them. And at times we go off and do a bit of research if we're not sure. So we might look at the literature or get someone to do a bit of a focus group or something to sort of better understand from our clients or, whether it floats. Sometimes people come up with great things, but they would cost quite a lot to sustain or implement. So the aim of this is to sort of one-off things that can either make a difference sustainably or pilot something in a way that is going to give us some information that then later on we can take to scale or change up. And so we have a budget of around $50,000 a year to support these. So some ideas might only take $5,000, some might be sort of a $10,000 initiative.
So of those 10 to 20, you could, in a sense, fund maybe 3 or 4 with that budget.
Yeah, that's right. That's typically how many we we fund each year. One of them was to introduce a new intervention that people felt was really powerful for people with trauma. And so it's just been about getting some people in the organisation trained up and then having the specialist external supervision. And then that's a fairly recent one. We haven't actually implemented that. We're just designing the evaluation around that so we can see what difference it makes and what the outcomes are. Some have been to create some resources that are effectively like little animations that the youth team are doing with their clients or some of the young people that they're working with in schools to communicate some messages to their peers. And that was really just spending a bit of money to support bringing in some experts around animation and some students from university who are doing that to pull a project together.
Fantastic. And do all of the initiatives have a requirement around evaluation, or can it just be an activity?
It could just be an activity, or ideas have come to just building a sort of walking track around the facility so that people can go for a morning walk without having to sort of leave the property and have a nice track to walk on. And, we know the impact of exercise on your wellbeing and health. And, we've been incorporating mindfulness or silent walks and things. So they're just like, well, can we have a walking track or some exercise equipment outdoors? So it can be very simple little capital things that, again, have been generated either from the staff or from the client saying, hey, we'd love this. Or our gym is looking really shabby and old. We need some new equipment in here.
What's the reception been amongst the staff? Because that's obviously a pretty high engagement, 10 to 20 out of about 250 staff. That's 7 or 8% of people engaging with it. Anecdotally, what's the sentiment been?
I think it's pretty positive, and the people who don't get up have applied again in future years. So I think they do see that some of these get up and some get implemented, and so that generates a bit of a momentum. I mean, sometimes when COVID slowed a couple of things down, and you can really see that when they're not implemented straight away and things stall a little bit, then you do notice the motivation to put the work in or effort or come up with new ideas can certainly stall as well.
So speed's an important factor here.
I think so, being able to respond to it quickly and support.
Strike while the iron's hot. When somebody's got the idea, support them to implement it and then try and ensure that they have got it in place within a couple of months or weeks.
Yeah, I think that would be ideal. I think that's what will make a difference. And what we're also seeing is some teams seem to generate lots of ideas and they'll put in regular ones and they're really well targeted and they tend to be more successful, and other areas of the organisation just coming up with things that are either impractical or are really expensive. And so I think that probably comes back to management to think about, well, how can we support people to perhaps further develop ideas a bit or put some more parameters around it to make sure that the things that are coming up are things that we can support, because you don't want to be saying no to people's great ideas. Someone can be resilient to once, yeah, but if you do it a couple of times and they just, think, well, my ideas aren't welcome or aren't valued here. And I think what we could get better at too is giving some better feedback to the ones that aren't successful and making sure that we better support them. That's a challenge in the busyness of organisations, even supporting the successful people sometimes around the staff resources or management resources to get it implemented can be a challenge when everyone's really busy.
Just to finish on then, Stefan, it'd be great to hear about this most recent initiative, the Odyssey Fellowship. Tell us a little bit about that.
Yeah, so I mean, I'd as you sort of mentioned in my introduction, I was lucky enough to get a fellowship to go and do some study overseas, and that was transformative to me. And hopefully I brought lots of that learning, and it did have a big impact on management and some of the things at Odyssey. And I have seen other people go on Churchill fellowships and things like that and really come back inspired. And it's also a really great way of retaining and supporting your really high-performing staff. So I thought, rather than just encouraging staff to put in for that, why don't we establish a similar program? And so this was our first year of running it, and we intended to support one staff member to go either overseas or interstate in Australia and do a period of study, or go and visit some services, or go to a particular conference or something that would have relevance for Odyssey, and then to come back and share their learnings in a little sort of 15-minute recorded conversation that they could make available to staff and also talk to the executive about what they learned. And we had a few applications, but two really shone and we couldn't decide between them. So we decided to award two in the first year. And both were to Europe to sort of visit services and programs and a conference. We provided up to $10,000 for each one of those to contribute towards expenses. It pretty much covered everything for those two. And we've had them come back and talk to the executive about their learning. They haven't yet put the presentation together for staff, but we're already thinking about getting the communication out for next year to get people thinking about what they might do. So I think the feedback has been really positive.
Well, thank you so much for sharing all those examples with us. It's been absolutely wonderful to have you on the show. The work that you do at Odyssey House is exceptional. I think it's another example of one of Australia's health services that's out on the front lines, just really making a difference in people's lives, one family, one community at a time. So really appreciate your time today and thanks for being on the show.
Been my pleasure. Well, thanks.
You've been listening to Outcomes, a show about uncovering the hundreds of micro-innovations that help make Australia's healthcare system one of the best in the world. This podcast is produced by AusMed, one of Australia's leading providers of educational content and software to the health, age, disability, community and allied health sectors. To find out more, head to our website, ausmed.com.au. To make sure you don't miss an episode of Outcomes, be sure to subscribe to or follow the show in your favourite podcasting app. And while you're there, please leave us a 5-star review as it really helps others to find the show. I'm Will Egan and I'll see you next time for another episode of Outcomes.